If you have an L5-S1 disc bulge and your leg or back pain is not improving, the answer might not be more stretches or exercises. It might be how you go through your day. I have helped thousands of patients with L5-S1 disc bulges, and the biggest improvements rarely come from one big fix. They come from reducing stress on that L5-S1 level in small, consistent ways throughout the day. In this video, I will show you exactly how to do that. You will learn a simple daily routine that helps calm nerve irritation, decreases disc pressure, and finally gives your spine a real chance to recover. That means less low back pain and leg pain. And watch to the end, because one simple thing you do first thing in the morning can be the difference between steady progress and symptoms that keep flaring. Hi, I'm Dr. Cordova, a chiropractor in Houston, Texas, with 29 years of experience helping people with chronic neck pain, back pain, poor posture, and sciatic nerve irritation. As a chiropractor, I believe the adjustment is the most powerful thing we do, and being specific with it matters, which is why I rely on spinal x-rays to guide every patient's care. On this channel, you'll get simple, specific, and safe strategies you can use at home to feel better fast. I share the same x-ray guided chiropractic strategies, posture fixes, and modern therapy insights I use in my clinic to help patients get long-lasting relief. Subscribe to learn how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable steps you can use right away. The L5-S1 area is at the base of your spine. It is where your lower back meets your pelvis, and because it sits at the bottom, it carries the weight of almost everything above it. Every time you sit, stand, bend, or lift, the L5-S1 level takes the load. There's also a natural forward angle at this level. That means that the L5 vertebrae is constantly tilted slightly along with the sacrum. Over time, repeated stress at this level makes this one of the most common spots for disc bulges and herniations. Now add one more factor. The L5 spinal nerve exits there. The L5 nerve connects with other nerves and forms a sciatic nerve which travels down your leg. So a disc bulge at this level can compress the L5 nerve and trigger sciatica leg pain. And it is not just mechanical. An irritated disc can release inflammatory chemicals that make your nerve more sensitive. This can also cause low back pain and leg pain. What you do during the day can unknowingly add more stress to this area, which is often why pain keeps persisting or flaring up. Stay with me, because I'm going to walk you through 4 daily habits that may help take stress off your injured L5-S1 disc, starting with one that often confuses many people. The first daily habit is to use ice and not heat to relieve pain and inflammation. When your low back or leg pain flares up, the instinct is to use heat. It feels good. It relaxes things. But with an L5-S1 disc bulge, that can sometimes make the problem worse. This is not just a mechanical issue, it is also chemical. When the disc is irritated, it can release inflammatory substances that sensitize the nerve nearby. That nerve runs right down your leg, and at L5-S1, there's very little extra space to handle that irritation. So when you add heat, especially in a flare-up, it can increase local blood flow and swelling in an already tight area. That can also increase pressure on the nerve, which is often why symptoms feel worse after. Ice works differently. It helps calm irritation. It slows things down. It gives the area a chance to settle instead of getting more reactive. Here's how to use it properly. Use a cold pack or even a bag of ice. Place it over the lower back, right around the L5-S1 nerve area. Wrap it in a lightly moistened towel so that the cold transfers better and protects your skin. Keep it on for at least 10 minutes. Make sure you do not apply it directly to bare skin for too long to avoid irritation. You can repeat this as needed, but give it at least 1 hour before applying the ice again. You may start to notice the area feeling less reactive and a bit more settled. It can provide comfort and at least temporary relief while helping counteract the effects of the inflammation. Also be mindful of this, which may seem subtle but can make a difference: the seat warmer in your car. If you are regularly driving and using heat at the same time, you may be adding hours of low-level irritation without realizing it. So this is not about avoiding heat forever. It is about using the right tool at the right time. Now, once you start calming the irritation, the next step is just as important, because even if inflammation settles, constant pressure on that L5-S1 level can keep things from improving. Daily habit number 2, to add or increase the lumbar support in your office chair and also your car seat. This is where most of the daily pressure adds up. It is not usually one big movement that irritates the L5-S1, it is hours of sitting. And when you sit without support, your pelvis tends to roll backwards, and that flattens the natural curve in your lower back. When that happens, the disc gets pushed backward, right into the space where the nerve exits. At L5-S1, that space is already tight, so even small changes in position held for long periods can increase pressure on the disc and the nerve. That is often why symptoms build slowly throughout the day instead of all at once. Lumbar support helps correct that. It keeps your lower back in a more neutral position. That means less backward pressure on the disc and more space for the nerve. Here's how to set it up. If your chair has built-in lumbar support, adjust it so that it fits into the natural curve of your lower back, not above it and not too low. If it is not, you can use a small pillow or a lumbar roll. Place it right at the level of your belt line so it gently supports that curve. The same applies in your car. Car seats often encourage a slightly slouched position. Adding support behind your lower back can make a big difference, especially if you are driving often. You are not trying to force your spine into an exaggerated arch. Just support what should already be there. Over time, you may notice less buildup of tension and fewer spikes and symptoms during or after sitting. It is a small adjustment, but it reduces a large amount of repeated stress on that L5-S1 level. Now, even with good support, sitting for long periods still adds pressure. So the next step is not just how you sit, but how long you stay there. Daily habit number 3 is to use a standing desk instead of a chair. The longer you stay seated in one position, the more the disc is loaded and the less space the nerve has. This is where many people feel that gradual increase in stiffness, tightness, or leg symptoms as the day goes on. So the goal is not just to sit better, it is to sit less. This is where a standing desk can help. Standing changes the angle at your hips and pelvis. It reduces the constant compression that happens in sitting and allows the spine to stay more naturally aligned. It also introduces movement. You shift your weight, you adjust your stance. Small changes, but they reduce the continuous stress placed on that L5-S1 level. Here's how to use it effectively. You do not need to stand all day. In fact, that can create its own problems. Instead, alternate between sitting and standing throughout the day. Start with short periods. Even 15 to 30 minutes of standing at a time can make a big difference. Then go back to sitting with good lumbar support. Think of it as breaking up the load, not eliminating one position completely. Over time, you may notice less buildup of pressure and fewer flare-ups triggered by long periods at your desk. It is not about doing more. It is about changing how long your spine stays in one position. And once you start reducing that daytime pressure, the next piece is what happens over several hours at night when your body is supposed to recover. Daily habit number 4 is sleeping on your back with a pillow under your knees. This is where your spine has the best chance to recover. You spend hours in this position, so even small improvements here can make a big impact on how your L5-S1 feels the next day. When you lie flat on your back without support, your lower back can arch slightly. That may not seem like much, but over several hours, it can keep that area under tension. Adding a pillow under your knees changes that. It gently tilts your pelvis and helps your lower back settle into a more neutral position. That reduces stress on the L5-S1 and allows the surrounding muscles to relax. It also takes pressure off the disc. Remember, this level is already dealing with constant load during the day. Nighttime is your opportunity to unload it. Here's how to set it up. Lie on your back, place a pillow under your knees so they are slightly bent. You should feel your lower back relax into the surface, not arch away from it. You are not forcing anything, just allowing the spine to rest in a more supported position. If you wake up stiff or sore, this is often one of the simplest changes that can help. Over time, you may notice less morning tightness and a smoother start to your day. Now here's your bonus tip. What you do in the first few minutes after you wake up can set the tone for your entire day. Your spine has been at rest for hours. The muscles that support it are not fully engaged yet, so when you go from lying down to standing or moving right away, the L5-S1 level can take more load than it's ready for. This is where a simple activation makes a difference. When you get out of bed in the morning, do something to activate your core muscles. Easiest to do a simple plank to get the muscles activated and supporting the low back and some glute bridges. Here's how to do it. Get down on the floor and set up for a prone plank. Position yourself on your forearms with your elbows under your shoulders. Extend your legs back and lift your body so you are supported on your forearms and toes. Keep your body in a straight line from your head to your heels. Do not let your lower back sag and do not lift your hips too high. Think about gently bracing your core like you are preparing for someone to tap your stomach. You have two options. You can do a max hold. Hold the plank for as long as you can maintain good form. Once your form starts to break, stop. Or you can do reps. Hold for 2 or 3 seconds, then come down and rest on your knees. Repeat this for 10 reps. As you get more comfortable, work up to 3 sets of 10 reps. Over the next few days, you should start to feel more support throughout your core and more control in your lower back. This can really help with reducing strain on the L5-S1 and improving how your back feels as you move through the day. You are not trying to push hard here. Just wake the system up so your spine is supported before everything else begins. Now here's the key to tying all of this together. It's called a daily routine for a reason. An L5-S1 disc bulge or herniation is not an isolated issue. It is something that is affected by what you do all day long. You can do exercises, physio, chiropractic, and even spinal decompression. They can all be helpful, But if you are not reducing the stress on your L5-S1 in your day-to-day life, the disc bulge cannot truly settle or improve as quickly as it should. That is why these need to be done every day. Consistency is what gives your spine and your disc injury a chance to recover. If you found value in this video, like and share it so more people dealing with low back and leg pain can find it. And tell me in the comments which of these daily habits is making the biggest difference for you. Remember to subscribe if you want to learn how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable tips you can use right away. And if you want to see the 5-step non-surgical treatment plan for L4, L5, and L5-S1 disc bulges that we use in our office, go watch this video next.